Good morning, everybody. Doc Dave here, and today we're going to do episode 29 on a very practical topic, the common cold. So, it's a common virus, and it's generally what we call a rhinovirus, and it's of the nose and the throat, so it's upper respiratory. It's not lower respiratory like we discussed earlier with pneumonia, where you get advanced bronchitis, which will lead to pneumonia. This is upper respiratory, nose, throat, ears, cough, that type of things. The symptoms are generally, like I said, runny nose, sneezing, congestion, low-grade fever, generally under 101.5. If it's 103, then you should be getting concerned something else is going on. And the causative factor is generally 90% of the times the rhinovirus. And the treatment for this is pretty basic. Don't generally need to go to the urgent care, don't obviously need to go to the emergency room, or you don't need to even go to your doctor. You go to your local pharmacy. And it's over-the-counter medicines like decongestants, like Sudafed or something similar to that, Zyrtec. There's a number of them out there. Cough meds, usually a decongestant cough med, a Robitussin DM. You usually don't need the codeine in there because you want to maintain the cough to a certain degree because you want to clear your upper airway. You suppress the cough too much, and that's mucus is going to drip down into your lower lungs, and there's where you'll get in trouble with bronchitis or possible pneumonia. So cough meds are okay, but don't get overly concerned about suppressing the cough. Tylenol, that's good for the achy pains, the myalgias, the arthralgias, and the low-grade fevers. Fluids and hydrations, very important. Eat well and rest. That's probably the best thing. I mean, you should be sleeping 14, 16 hours a day. Just stay in bed, get up and move around a little bit, but just take it easy. No outside activities, no walking, no exercise. So there's 4 stages to a common cold. There's the incubation phase where the virus gets into your upper airway and it starts to incubate. There's the early stage where you generally have congestion and, not much of a cough, a little sore throat, but you're starting to feel bad. You get a little achy painy, so you know something's going on. Then there's the peak symptoms, okay? And that's usually where you get your pretty severe sore throat, coughing, spasms, maybe even somewhat productive, fever, 101, 101.5, and achy, myalgias, arthralgias. Then you hit the recovery phase. Usually it takes good 10 days to completely resolve a cold. So be patient. There's nothing you can do to speed it up. There's things you can do to resolve the symptoms, which I already went over. But, you could take vitamin C. That kind of helps, but you're not going to get rid of the cold in 2 or 3 days. Let's put it that way. Now, how do you relieve some of the symptoms other than the over-the-counter medications? Well, blowing your nose. However, there's a little caveat here. You don't want to blow your nose too much because the mucus in your nose protects the lining of your nasal mucosa, which prevents the rhinovirus from seeding in deeper. So, you can blow your nose, but don't be obsessed about blowing all the mucus out because the mucus is helpful and it's preventive and it's there for a reason. So kind of, take that with a grain of salt. Number 2, drinking warm water helps. It soothes the sore throat, it loosens up the congestion, and it prevents dehydration. So warm water, not cold water. Warm it up a little bit. A little tea, herbal tea, drink it. It's going to feel good. Number 3, fresh air. You can go outside, but don't go out if it's cold and get a chill. So, sit out on the porch, sit out on the deck, get a little fresh air, open the window if you're in the bed. So, number 4, the vitamin C. It does minimize the length of the cold only slightly. So instead of maybe 10 days, it's 7 or 8 days. Number 5, sniffing and swallowing mucus. Now, I know that sounds a little odd and maybe even a little gross, but if you swallow the mucus, it's a way of getting it out of your system without overly blowing your nose, which can really irritate your nasal passages. It goes into your stomach, obviously, and the hydrochloric acid in your stomach will break it down and it will kill the virus. So it's not dangerous to swallow the mucus, no matter what you may think. So it's okay. Number 6, hot showers with a steam in the room. Close the doors, close the windows. Take a nice hot shower. That'll really relieve the myalgias and arthralgias. It'll clear up your nasal passages with the steam like a humidifier or a vaporizer would. And it's really going to feel good. So that's a good way to relieve some of the symptoms. Number 7, vitamin B12. It does help suppress the coughing to a slight degree, which is what you want to do. You don't want to over-suppress it again, but you want to kind of minimize it because it's, it just, it doesn't feel good, and people around you don't want to hear you coughing all the time. And, it interrupts your sleep you may be getting. So vitamin B12 does help that. Sit in the sun a little bit. The vitamin D will fight off the cold to a slight degree. It's not a magic wand, but, all these little things help. The vitamin B12, the vitamin D, the vitamin C, they all help and prevent it from getting worse and may minimize the symptom length that you have. So those are things that you can do, as at-home remedies. Now, best over-the-counter meds for the cold. Now, I mentioned earlier, just in general, just decongestants, cough medicines, but Robitussin is a really good cough decongestant, the DM, which is going to be a suppressant and loosen up the secretions. Dayquil. That's really helpful too because it has a variety of medications in it, and it helps you get some sleep during the day as well. And then there's NyQuil. The packages nowadays come with Dayquil and NyQuil. The NyQuil has a little Benadryl in it, so it helps you sleep, but it basically is the same as the Dayquil. Theraflu, nice hot warm tea with some Theraflu in it will help your symptoms as well. And a good decongestion is over-the-counter Sudafed. Don't forget the chicken soup. Mom used to always give us that. It's got all the vitamins in it that you need, and it's really tastes good, and you don't have to digest it because it's mostly broth, and it keeps you hydrated. So, also the last couple of things, Mucinex is really good for loosening up the congestion in your sinuses, because you don't want to get a sinusitis. That's really miserable. You get headaches, your sinuses are swollen, your ears start to back up, and it just doesn't feel good. So Mucinex is really good, and it's called Mucinex Night Shift, cold and flu. I've used it myself. It does work. So, and then, basic Advil or some kind of an anti-inflammatory, a non-steroidal, just to help with the myalgias and arthralgias. So, a few other common things that is in the household a lot, or if it's not, it should be, is hydration and humidity. Keep yourself hydrated. Don't get dehydrated. You should be urinating at least every 2 to 3 hours, so that's your guideline to use. Lemon in your water is really good, and it tastes good, and it soothes your stomach, and it does have some medication, some influence in your symptoms, in that it decreases the congestion and decreases the sore throat. Onions. Believe it or not, there you go. Onions, another good use for onions. It thins out the mucus a little bit so you can remove the excess mucus. Magnesium and omega-3s and vitamins C, D, A, and E protect lung health. So those are important. So if you got vitamins at home, make sure they got some magnesium in them. They got omega-3s and, multivitamin with C, D, A, and E. So cinnamon, ginger, and turmeric are really good. For the ginger for if you got an upset stomach or nausea, the turmeric for any inflammation problems, and cinnamon just kind of settles the symptoms down. I don't know how it really works, but they say it is something if you take, you will get a positive response from. So that's pretty much it. There's menthol things you can take, such as cough drops and cough medicines and throat lozenges, which are also helpful. But the takeaway from this whole thing about the common cold is obviously it's common and everybody gets it in the winter. It is contagious, so be careful if you're around people. If you got somebody at home that's sick, put a mask on them or put one on yourself if you need to. It generally doesn't lead to anything more serious. You rarely get bronchitis or pneumonia from it unless you have really bad lung disease, COPD, or emphysema from decades of smoking. Then you might want to be more aware and let your doctor know. Or if you're immunosuppressed. Those are all things that you can discuss with your physician. So that's the topic. I hope you enjoyed this. It's just kind of an overview of the common cold. Nobody's come up with a cure for it yet, even though they've been trying forever. Maybe one day. But it's just something that you can expect at least probably once during the winter months. So, hope you like this. Pass it along to your friends. Everybody will get exposed to it one time or another in the winter, so this is how to get around it. And I'll be back again with another episode. Thank you for your time today.